Hello, I'm Latha, Chief Dietitian, Medicover Hospitals, Madhapur. Today I'm going to talk about spirulina. Now, spirulina is something like it is a unicellular microalgae which is usually seen in water. It can be salt water, it can be a brackish water, or it can be a freshwater lake. So, to this microalgae to survive, you need a very good pH of water. It should be alkaline in nature. Up to 10 to 12 pH of water should be maintained for its sustainability. So nowadays in market we have got many spirulina supplements. You have them as capsules, you have them as powder form, and also as gummies. Now what is this spirulina going to do for our benefit? So there are many research studies which are there across the globe. Usually it is native of Africa. There are researchers which are showing that Chad, a place in African country, have survived only on this microalgae for many years together when famine was there. For many years, the people ate only this and they survived very well. So it has very rich nutrient properties and also have most of the medicinal and health benefits from properties. And it is now termed as a functional food or a nutraceutical rather than anything else. So this algae, which is especially seen in Asia, little parts of Asia and in Central America, and mostly it is native of Africa. So there are studies which are showing that this is a cardioprotective. That means it is good for heart. It reduces the LDL cholesterol in our body. It increases the HDL cholesterol because of its fiber content. It will remove out the bad cholesterol out of the body. These are proven studies. Apart from that, it is a liver protective. That means the hepatic cells rejuvenation can happen with the spirulina supplementation. There are studies which have proven that it is a very good cancer suppressant. It is a very good antioxidant. So the tumor cells suppression is seen when there are researches conducted across the globe. So most of the T cells, B cells and macrophages are developed when you supplement this spirulina in human subjects as well as in rat models. Apart from the anti-cancer activity, it is an excellent anti-inflammatory. So any inflammatory diseases which are there in our families or the people who are prone for certain arthritis or any other inflammatory lupus or any issues like that. So the supplementation has proven that the inflammation has gone down in the body. So it also has a very good role in eye health. Especially it has loads of beta carotene. So 100 grams gives us around 6 lakhs micrograms of beta carotene. So it is an excellent source of beta carotene. So for our eye health, it is really good and it improves the immune system. Again, it is a potent antioxidant because of its carotenoids which are present in them. There are zeaxanthin, xanthin, and phytocyanins are present in this particular food supplement. So this phytocyanins again are hepatoprotective and also suppresses the cancer cells and builds up the immune system. There are many nutritional properties. It has loads of vitamins and minerals. It provides around 333 kilocalories of energy, around 10 grams of protein, and less than 5 grams of fat. It is zero in cholesterol and it has got many vitamins, like all the B complex vitamins are there, lot of carotenoids, minerals like magnesium, iron, zinc, copper, selenium. There are studies which have proven that supplementation of spirulina has prevented anemia in many subjects. Apart from this, for overall well-being of a person, spirulina supplementation would be an ideal food for the patients who are suffering with multiple deficiencies or patients who are at risk of cardiovascular diseases or with families who runs cancer as their genetic risk. So this is an excellent supplementation. But always we need to understand, though it has got immense medicinal properties and nutritional benefits on us, the side effects are again most important. So spirulina will not allow the blood to form clot. It prevents clotting in humans. At the same time, patients who are at risk of bleeding can have some, if they have some bruises or anything, they may end up with excessive bleeding disorders or any bleeding issues and can be fatal. Certain things should be taken into consideration, and we need to also understand the allergies of it. Patients who are hypersensitive should not be taken, and there are no studies for the pregnant women population whether it is advisable or not. So further areas of research is needed in regard to spirulina supplementation in pediatric population as well as in pregnancy. But otherwise, it is a very good antioxidant, anti-inflammatory, and it is an excellent antiviral for flu, influenza. Even there are studies like phytocyanin, which is present, is able to kill the HIV virus. There are studies from Central Africa where the existence of HIV is number one, but in the areas where spirulina is consumed, the prevalence of HIV intensity and the spread is very less because of the consumption of spirulina. So because of its excellent antioxidant properties, anti-carcinogenic, immune building, and tumor suppression properties, and reducing the viral infection loads, and excellent nutrient supplements for multiple vitamins, minerals, trace elements, and antioxidants, spirulina can be taken under medical supervision or a dietitian supervision under safe recommendation of 40 milligrams or less than that per day.